I've had pain in my foot for probably I'd say about 2 years now. I walk a lot, about 4 miles a day. So anytime I'm walking or even wearing sneakers, just standing around working, I have pain in my foot, by my big toe. Finally, I decided to go stop complaining about it and see a podiatrist about it, and I went to New Jersey Spinal Wellness. First doctor I met was Dr. Saymeh. He listens to what you have to say. He takes his time when you're there to see him for follow-ups and explains to me right away that it would be either 4 or 5 weeks in a boot, possibly 6. And on the day of surgery, I would be walking out in that boot. I would not have to be on crutches. It would be minimal invasive. That's what the key for me was, minimal invasive. Surgery went really, really well. He was so happy with the surgery. You would never know I went through that type of surgery minimal invasively, because really, the only pain I needed maybe, Advil for the pain. There was no pain. There was no crutches. Like I said, I walked away that day in the boot. Anytime I went for physical therapy after surgery, they'd ask me, where's the pain, what's the pain level? And that's how they would base how they're going to do my exercises. Everyone there took anything I said seriously. So I wasn't made to feel a certain way, like, oh, that's probably all in your head. Any issue I had, which wasn't all that, was just really the walking, the proper way to walk, the proper way to press on my toe. They took seriously and gave me exercises for. And then when someone's working with you, they might meet and talk and say, okay, this is what she can do. We can do this for her today, we can do that for her today, but not this, that, and the other. So it's like a team. It's almost like being on a football field, and I like that about them. They all know, everyone talks to each other and communicates, they all know what's going on. I would tell someone who had bunion pain like me to go see my surgeon at New Jersey Spinal Wellness, have minimal invasive surgery. That's what I tell anybody who says anything to me about, well, I don't want to be on crutches. Have minimal invasive surgery, MIS surgery. There's nothing to be afraid of. There's no crutches. There's no little wheelie thing to put your knee on, to get around your job. You're in a boot, and that's it. And like I said, hardly any pain at all.